Hello and welcome to today's Here's to Your Health podcast. I'm your host, Don Linsman. My guest on the podcast today is Joe Weber. Joe is a doctor of physical therapy. He's in our Rehab Services department. And Joe, thank you for joining me today.
Yeah, thank you for having me, Don.
Joe, you're one of our newest full-time members of our staff. Not to say that you weren't here before, because I think you did a rotation with us when you were getting ready to go to grad school. But why don't you tell us a little bit about yourself, about your education and experience, and we'll kind of start from there.
Yeah, so I grew up in a house outside of Dunlap, Iowa. So I have 3 older siblings and went to school and graduated from Border Valley in 2018. Went on to Central College down in Pella, Iowa. Got my bachelor's in kinesiology. On the kind of pre-PT route, and then went immediately after graduation, pretty much had a couple months off, went immediately into PT school at Des Moines University. Was there for 3 years and just recently finished up. So yeah, now I'm back at kind of back home and serving the people in rural Iowa. So
this is one of those local boy makes good stories that I always like, but it's great to have you back. Glad you're here. What drew you to physical therapy in particular as a profession?
I always knew I wanted to do something in healthcare, in the medical field. And then just growing up, I was always involved in a lot of sports. So I've always been a very active person. So that was one reason that kind of drew me to PT. I think it's a very active profession. You're encouraging people to be active. But also just the time you get to spend with patients. I think you really grow relationships with people. You know, you're seeing them for usually at least 45-minute appointments, and you're seeing them 3 times a week for multiple weeks. So you really build that rapport with patients and get to know them, their story, and what they want to get back to doing.
And to wrap up this segment of the podcast, for any young people who might be listening today who are contemplating a career in healthcare, what would you tell them about that?
I just think explore your options, learn as much as you can. I think, especially if you are interested in a field and thinking about something, talk to people and ask about observing. That's what I did. I observed PT, and then observe, if you're interested in multiple fields, observe every profession and kind of pick out things you like, things you don't like. Talk to people that are in those professions and what they like about them and what they don't like, and just be a sponge, absorb as much as you can.
So the internship program that we're currently operating is a good idea for sure. Students who are thinking about it.
Mm-hmm. I wish that that would have been something that was going on when I was in school. I think it's a great opportunity. You get thrown in and get to learn as much as you can and follow people that know a lot about healthcare and what's going on. So
our program this year is full, but we're hoping to continue to run this. So perhaps next year for all of you young people who are out there listening to this today. My guest on the podcast today is Joe Weber. Joe is in our Rehab Services department, and we're going to start talking about National Physical Fitness and Sports Month, which is what May is. And I think what spurs my interest in this today, Joe, is that there are significant numbers of people who are interested in losing weight and getting healthy and so on and so forth. And we talk a lot about diet, and people can focus on their diet because that's relatively easy. I just have to not eat certain stuff, and maybe not quite as much of that stuff as I have been eating. But the physical fitness part of this always seems to be a little bit more of a difficult get. Mm-hmm. Why do you think that is? Why do you think that people kind of shy away from the physical aspect of this?
I think it's multiple reasons. I think one of the reasons is, I think people think in terms of physical fitness, whether they're just starting, they think they have to make these big changes, and they see things that people do on social media and whatever on TV, and they think, I can't do that. But it really is just small changes to make yourself more active, whether that's, just trying to find ways throughout your day to increase your activity, whether that's parking farther away to increase walking, taking the stairs instead of an elevator if that's something you do, or just walking, over your lunch break. Just adding those small pieces of increased activity really help throughout your day. And then, I always say walking is a very underrated form of exercise. It's good for the brain. It's good for the heart, the lungs. It's good for the muscles. So I think that's part of it, is people just think they have to make these really large changes to become more physically active, when it really is kind of those small changes that really get you going.
And you make a point that I have thought about more often than not over the last several years. I've been working at losing weight. I've lost about 35 pounds. And my very first thought was, well, I need to go buy a home gym, or I need to go get a treadmill, or I need to go get an elliptical. And I've thought about all those kinds of things. But over the years, I guess I understand what you're saying, and it's really less about getting into some sort of a physical fitness program and a lot more about just becoming more active in the things that we do on a daily basis. And I think you've given some really great ideas about how people can continue to do that.
Yeah, and I think another big point that we like to talk about, especially in rehab, we like to think about, okay, how can we get you back to functional activities, but also we want to make activities that are salient, so things that are important to patients that they enjoy. And so that can be applied to, exercise and working out too. Like, you have to find things that you enjoy, because physical activity, you have to be persistent and you have to adhere to it. So
you're really talking about sustainability, finding something that you can sustain.
Yeah, so I tell people, people think about, I have to go out and lift these weights. So if you don't like lifting weights, don't do it. Like, you're not going to do it, you're not going to want to do it, and you're not going to stay persistent with it. So find a different activity, whether that's, whether you like playing like pickleball or tennis or whatever it is, whatever activity you enjoy, like, pick that as your activity and just stay with it, and anything to become more physically active.
My guest on the podcast today is Joe Weber. Joe is a doctor of physical therapy, and he works in our Rehab Services department. We're talking about National Physical Fitness and Sports Month. When we talk about physical fitness, it goes back to what you just talked about, doing that, daily activity, just getting a little bit more moving around, so on and so forth. But Joe, what about people who end up either with, they hurt themselves, or they have some pains maybe in their joints or in their muscle groups that keep them from being able to exercise or do some of the kinds of things that they like? What would you suggest that those people end up doing?
I think anything like that, I think just discussing with your primary care provider and seeing what the issues are, and then maybe getting a referral to rehab physical therapy. Because we can, we like to consider ourselves movement experts, so we can kind of find those faulty movement patterns, or whether that's, a strength issue, a balance issue, anything like that, a posture issue, and we can kind of work on that. And then our goal is for you to be able to get back to doing the functional and salient activities that you enjoy. So
I'm going to ask you one question first, and we're going to come back to the posture issue, because unfortunately that tends to be a real problem for an awful lot of folks. But let's go to the other issue. You talked about the pain, and you're looking for ways to help solve those issues. I guess one thing I really want to make sure today is, when we talk about going to see your primary care provider, it doesn't necessarily mean you're going to get any sort of testing. It's not an invasive procedure. Usually we take an extremely conservative approach to try to fix that problem without, before we go to the next level.
Yeah, for sure. That's our goal, is we want to be able to fix your issues with the least invasive we can, and especially coming to therapy, that's our goal, is we want to treat you conservatively, and we want to find those faulty movement patterns, whether, like I said, whether that's balance, weakness, faulty posture, whatever that is. And we want to, our goal is your goal. We want to get you back to doing the things you want to do.
And as human beings, we're sometimes our own worst enemies in terms of we overdo certain things. I mean, when I'm out working in my yard, I know there's only a certain amount of time, a certain amount of bending or stretching that I can do before I know I'm going to have either back or legs or something that's going to hurt. Posture is something else, I think. That's a huge issue for people. We're our own worst enemies. What would you tell anybody who's listening about that today?
I mean, I just think, us as humans, we become sedentary. I mean, most of our jobs are sitting at an office and doing computer work and things like that.
Which, by the way, we are sitting in an office and doing this podcast today, so.
And, as humans, we're not meant to sit for 8 hours a day. You can't maintain healthy posture for 8 hours. So I think just getting up, try every 30 minutes if you can, just changing your position, whether that's even just getting up and walking to the printer, walking and getting a cup of coffee, just any sort of those small changes to be able to change your posture and help maintain good alignment.
My guest on the podcast today is Joe Weber. Joe is a director of physical therapy here, or a doctor of physical therapy in our Rehab Services department. We're talking about National Physical Fitness and Sports Month. As we finish up today, Joe, if there's anybody out there who is kind concerned about maybe some chronic pain that they're having, not acute, because we know that there's a difference between acute and chronic. Maybe we should speak to that first. How do people know whether or not they need to go directly to the emergency room or see a provider or do all those other kinds of things? If it's an acute pain versus a chronic pain, how do people know how to differentiate those two?
So I think, acute pain usually comes with some sort of injury typically. So I think any sort of severe change in pain would be, something to monitor. But if it's kind of that dull aching pain that you've kind of been used to, that's probably more of a chronic pain. But if it's more of like that sharp or shooting pain, that's a little bit more concerning, especially like early on. So.
And I do think that to a great extent people can figure that out for themselves, but there are times when I know we've had people who have presented either in the clinic with something that should be in the emergency department or in the emergency department with something that should be in the clinic. It is difficult for people to really understand that.
And I think people, typically your own body better than others, so I think, it's hard for me to tell you whether what you're feeling is more of an emergent issue or whether it's more of a chronic issue. So, like I said, I think people know their bodies more than anyone else. So just kind of go with whatever you feel is in your body. And
you're new, although you've been here before.
Yep.
You're new to our physical therapy department. Are you looking for any particular kind of patient you want to work with? Is there any particular sort of muscle groups or anything else? I mean, is there kind of a specialty that you have that you want to kind of get out there for folks, or?
Not really. I think just early on, just being able to serve, as many patients as I can. I like being exposed to a variety of things. That's one of the reasons why I wanted to come back here is, you can go to, your outpatient clinics and specialize in something, or you can go to different other specialty areas in PT, but I really just wanted to treat a variety of people. I had some experience at a neuro facility. Well, that was my last clinical, so I have some good experience in terms of stroke and brain injury and things like that, concussion and dizziness and things like that. So I really like working with that population, but I also have a big sports background and just general orthopedic background. So just a good variety of patients, I think, for right now.
So you get some final thoughts today. What are the final thoughts for the people who are listening who should be, like me, more physically active? What would you suggest? So I can go do that.
I just think, like I mentioned earlier, just finding those activities that you really enjoy, and then just finding, whether that's even like family walks or things like that. Just find people that can maybe help you adhere to things, because when we work more with people, we tend to, want to maintain and stay persistent. And then just like I talked about earlier, a lot of our jobs, like I mentioned, are just very sedentary. We sit around. So just trying to change positions every half an hour at least, and just adding in small changes and, stay persistent and try to make those short-term changes into long-term changes.
Joe, thank you for joining me today. I appreciate that very much. You're really good at this. So we're going to have you back soon.
Thank you very much.
My guest on the podcast today is Joe Weber. Joe is a doctor of physical therapy in our Rehab Services department. If, in fact, you have some pain and you want to see somebody at our Rehab Services department, you'll need a referral. So contact your primary care provider. If you don't have one, you can contact CCMH Medical Clinic at 712-265-2700 and arrange a consultation, and we'll be sure that we get you taken care of. I'm Don Lintzman, your host for the Here's to Your Health podcast. Thank you for listening today. Have a great day.